Well, I'm Sue Casteel. I'm an environmental health scientist with ATSDR. ATSDR stands for the Agency for Toxic Substances and Disease Registry. We're actually part of CDC based in Atlanta, Georgia. There are basically two different types of exposure that we see with mercury. One is an acute short-term exposure, and the health effects that we see in acute short-term exposures are headaches, nausea, vomiting, diarrhea. You may have trouble breathing, you may have chest pains, you may have inflammation of your mouth and your respiratory tract. If you're exposed to mercury chronically for a long period of time, then we start seeing much more serious health effects. These health effects would be primarily damage to the central nervous system. They would be characterized by tingling or tremors in your hands, tingling and shooting pains in your feet, fatigue, irritability, being very emotional, shyness, blushing, memory loss, anorexia. There are just a lot of really serious health problems associated with chronic exposure. That may not be what doctors are looking for when they're trying to diagnose a person's problems. Some people can have symptoms of mercury poisoning at much lower exposures than other people. There's just a very wide variability among people about how they will respond and what kind of symptoms they will have at what different levels. In some cases, if you're exposed to two chemicals at the same time, you may see synergistic or additive effects. So the health effects of the two separately, when they're combined, are greater than you would expect to see. We basically have three sensitive populations that we're concerned about being exposed to elemental mercury. One is elderly people because they're more likely to have underlying kidney problems. Or groups of people who have respiratory problems because exposure to elemental mercury vapors can cause respiratory and breathing problems. The second set of people that we're concerned about is young children. One is that young children breathe faster than adults. So if they're in an environment where there's mercury vapor in the air, they're going to breathe in more than an adult would because they're simply breathing faster. Another factor is that their brains are still developing, and we think because their brains are still developing, they're much more susceptible to the central nervous system damage that mercury can cause. The third group that we're really concerned about is pregnant women, because we know that if a pregnant woman inhales mercury vapors, the mercury vapors can cross the placenta and can get into the fetus or the unborn baby and cause health problems for the unborn baby. We would prefer that pregnant women not be exposed to elemental mercury vapors at all, because there is some risk there to the fetus. But what we do recommend is that they avoid exposure if at all possible, and if they are in a situation where they are exposed to elemental mercury vapors, they leave immediately. The key message here is just don't be exposed, and if you are, get away as quickly as you can.